Welcome to the deep dive. Today, we're focusing on corneal ulcers. They're actually quite common, but potentially serious things affecting the eye.
That's right, affecting the cornea, that clear front part.
Yeah, exactly. Ever wondered what actually happens when that, protective layer gets damaged or infected?
Well, that's what we're here to unpack. We've gathered info from various sources to give you a really solid, clear overview for revision.
Perfect. So let's kick things off. What exactly defines a corneal ulcer?
Okay, so it's essentially an open sore. Or you could think of it as an infection right on the cornea.
The clear bit at the front.
The clear bit, yeah. The eye's sort of windshield. And really crucial thing is if they're not treated properly, they can cause real problems. Vision loss, even.
Serious stuff.
Yeah, even perforation, like a hole going through the cornea. So it's not something to ignore.
Definitely not.
Mm.
That windshield wound analogy is helpful. So what causes them? What are the main culprits?
Mostly, we're talking about microorganisms. You know, tiny bugs.
Like what?
Well, bacteria are a big one. Things like Staph aureus, Pseudomonas aeruginosa, they're pretty common offenders.
Okay.
Then you've got viruses, Herpes simplex, the cold sore virus, and Varicella zoster, which causes chickenpox and shingles. They can both affect the cornea.
Right.
And fungi, too. Candida, Fusarium, less common maybe, but they can cause nasty ulcers. And even parasites.
Parasites.
Yeah, Acanthamoeba is the main one there, often linked to contact lens wear, especially with things like swimming or showering in lenses.
Wow, quite a range. Are there other factors, things that make someone more susceptible?
Oh, absolutely. Anything that kind of compromises the corneal surface. So direct trauma to the eye is one.
Makes sense.
Improper contact lens use is huge. Not cleaning them right, wearing them too long, sleeping in them.
That's a really common one, isn't it?
It really is. Also, having really dry eyes or other underlying corneal issues can make you more vulnerable. You know, it highlights how important good eye hygiene is, especially with contacts.
Yeah, definitely a key point. So who's most at risk then?
Well, as we said, contact lens wearers are right at the top of the list, particularly if hygiene isn't great or they wear them for extended periods.
Okay.
Also, people who've had a previous eye injury or maybe eye surgery, those with existing eye surface problems like blepharitis or severe dry eye.
Right.
Being immunosuppressed for any reason is another risk factor. And like we mentioned with Acanthamoeba, exposure to contaminated water or even soil.
There's a lot there. Is there an easy way to remember those?
Yeah, there's a handy mnemonic. CLESS, it stands for contact lenses, injury, problems meaning ocular surface problems, immune issues, and soil or swimming exposure.
CLEP.
Ah.
Nice. Okay, so what's actually happening biologically when one of these ulcers forms? The pathophysiology.
So basically, those pathogens, the bacteria, viruses, whatever, they invade the corneal tissue.
Get past the defenses.
Exactly, and they start to, well, distort it. This triggers a big inflammatory response from the body.
Which causes the symptoms.
Yes. That inflammation leads to the ulcer itself, the pain, the redness, the decrease in vision. In really bad cases, the tissue gets destroyed so much that the cornea becomes thin.
And could perforate.
And could potentially perforate, yeah. You could think of it like a tiny crack appearing in a window, and if it's not fixed, it just spreads and weakens the whole thing.
Got it. So if someone comes in with eye pain and redness, what else might be going on? What are the differentials?
Good question. You need to differentiate it from other things. It could be a simple corneal abrasion, just a scratch, or certain corneal dystrophies.
Okay.
Definitely need to consider specific types of keratitis, like herpetic keratitis if it looks viral, or fungal keratitis. Basically, ruling out other causes of corneal inflammation or infection is key. Getting the diagnosis right is vital.
Makes sense. How common are these in the UK, generally speaking?
Well, precise numbers are a bit hard to pin down, but they're considered relatively common, especially, again, in those high-risk groups, contact lens wearers, and people with existing eye surface issues.
Right. And what are the absolute classic signs and symptoms someone should be looking out for?
Okay, the big ones are pretty significant eye pain, redness, often quite marked, that feeling like something is in your eye, you know, a foreign body sensation. Also, lots of tearing, blurred, or just decreased vision, being really sensitive to light photophobia, and sometimes a discharge from the eye.
And you can see it sometimes.
Yeah, the eye often looks inflamed, and you might actually see a white or cloudy spot and infiltrate on the cornea itself. There's another mnemonic for this one.
Prideful.
Prideful.
Yeah.
Pain, redness, foreign body sensation, discharge, photophobia, ulcer appearance, and lacrimation, which is just tearing.
Prideful. Okay, useful. So how do doctors confirm it's an ulcer? What investigations are done?
The absolute main thing is a detailed eye exam using a slit lamp. That's the microscope they use to get a really magnified view of the eye, especially the cornea.
Right.
And very often, particularly if an infection is suspected, the ophthalmologist will take tiny scrapings or swabs right from the ulcerated area.
To send up.
Exactly. Send them to the lab to culture them and figure out exactly which bug is causing the trouble. Key findings during the exam would be the pain, the light sensitivity, the watering, and seeing how the ulcer area stains with a special dye called fluorescein.
Okay. And once it's diagnosed, what's the management approach, say, in the UK?
Treatment needs to be started quickly, and it's usually quite aggressive. The goals are simple. Get rid of the infection, help the cornea heal, and stop any serious complications from happening.
Makes sense. What does that involve?
Most often, it means intensive courses of antibiotic or antifungal eye drops, sometimes ointments too. If it's viral, then antiviral medications. Pain relief is important too, of course. Sometimes they might use an eye patch or a special bandage contact lens to protect the eye and help it heal. But for really severe ulcers, maybe if there's a risk of perforation,
Then what?
then hospital admission might be needed for more intensive treatment, maybe even intravenous antibiotics. And in the worst cases, if there's severe scarring or perforation, a corneal transplant could be required down the line.
Right, so it can get quite serious. What's the general outlook, the prognosis?
It really varies. It depends heavily on what caused it, how bad the ulcer is, and crucially, how quickly treatment was started.
So early treatment is key.
Absolutely. With prompt, appropriate treatment, a lot of corneal ulcers actually heal up very well without causing long-term vision problems.
So good news.
But on the flip side, if treatment is delayed or if the infection is particularly aggressive, then unfortunately there's a real risk of permanent complications.
And it brings us to complications. What are the main concerns there?
It really comes down to vision loss and corneal scarring. Those are the big ones we aim to prevent with that early aggressive management. Scarring can permanently affect how clearly you see.
Okay, so wrapping up, the key takeaway is corneal ulcers are serious, they need immediate attention, but the good news is they are treatable, especially if caught early.
Precisely. Prompt diagnosis and management make a huge difference.
Thinking about all this and just how vital our vision is, it makes you wonder, doesn't it? What simple, maybe daily habits could we all perhaps reevaluate to better protect our corneal health? Something to think about.
Definitely food for thought. We really hope this deep dive has helped consolidate your understanding of corneal ulcers, giving you a clear framework for revision.
And if you're looking for more resources, particularly for exam prep like the MSRA, do check out pastthemsra.com and freemsra.com. Thanks for joining us for this deep dive.